Hello, my name is Dimitar Filchev, and I am teaching in the University of Sofia in the Faculty of Dentistry. I'm in the field of prosthetic dentistry, implantology, digital dentistry, and aesthetic dentistry. I started working 24 years ago in a small dental office with my father. So at that time we had only 2 dental units, and we decided that it's good to grow. I was also at the same time starting teaching in university, and at a certain moment my father decided to work only in the university and left me alone in the office, so I had to find partners to work with 5 years later. So I found a very young, ambitious dentist, and she joined me at that time, so I would be happy to announce Dr. Ruseva.
Hi, hello, my name is Dr. Ruseva. I'm part of the team because we are a big team with a lot of dentists which are working together. I'm happy to be in this growing dental clinic, and now we are in our new dental center. It's the Top Dental Center, where we are working since 1 year in a different way, in the different perspective, in a different treatment plans, and all the different type of dentistry.
So actually we came to that point not immediately. It took us like almost 20 years. We were growing very healthy and slightly during these years. So after we had 2 offices, then we had 3, then we had 4, then we had 5. So we were slowly growing in our clinic, also growing in terms of education, growing in terms of team and equipment. So in 2016 we were celebrating 25 years of our dental office, and we saw that we have one of the most modern equipments in the world. At that time we had full equipment for 3D scanners, digital, but we didn't have space. We had so many patients around, and our space was very limited, so it was not we were not able to grow more, and we had to take the decision to go for the next step. So we could go for a next step just by having another big clinic, but honestly we decided to try to be different and try to make a great international project in Bulgaria. And we are organizing since 2007 the biggest dental meeting in Eastern Europe. It's called the Sofia Dental Meeting. So based on that, we had a really good way to connect to many people, many famous dentists from all around the world. We were traveling a lot. We got really very well educated. So all this created in our mind a great vision how to move forward with our project. A breaking point for me was my visit at the Columbia University in New York, where I saw really a very advanced way of documenting, a great managing software for the dental office. So we knew that it's difficult to have a private project which could copy an organization structured in a university. For that we decided to look for international partners, and we had really the big luck to have to be able to start this project together with three of the most famous dentists in the world, Professor Nichan Bichacho, Dr. Galip Gurel, and Dr. Mirela Ferraro. So in 2017 we started our conversation about how to create something unique for this part of the world. And it was really a very, very nice journey.
It was a very interesting and great journey, because to choose the place where it should be, this was very important and very difficult for us. We visit 100 places during our city where we can find a perfect place to have this idea. But one of the first places was the place where we are now. It was already a building which is built, but we stayed on the last floor, and we were shocked. This was our image of way of thinking where should be this dental clinic, because the view is great, the patient will feel very nice and very comfortable, and of course our idea is different. So we decided that the place where should be this dental clinic should be very different from the other clinics, like a building, like a structure and everything. So we start.
Yeah, actually the building is different. It's more connected with the tower in Pisa than in any normal building in Sofia. So it was kind of crazy, because it's not straight, but it's angled. And it's in the most modern part of the city, where it's also planned for building quite Sofia modern city. And we decided to try to move in this direction. It's on the edge of the city, exactly in front of the Sofia Exhibition Center. But what we knew, that there is a big perspective of growing that place, and we knew that there are a lot of companies with more than 3,000 employees around. So for us it was a great occasion to start this new project. So immediately we go to our partners, and even it was a rough construction at that time. They came, we were wearing very funny hats, and we visited the place. At that time, 12 floors, we had to go by foot, so it was a good exercise. But it was worth it to see the last floor, to see the nice view, and to see the perfect perspective. So we all looked each other, Galip, Nitsan, me, in our eyes and say, okay, this is the place, so we need to get it. So then, having the place, we started also to build the idea. And the idea was to have an amalgam from education, dental clinic and research. So what we wanted to achieve is really something that there are not many centers around Europe, not to be only focused on dental treatment or only on education. We wanted to have everything. So we believe that the research, which is a huge part of our daily work, the treatment plannings, the clinics and the education going hand by hand, could make all the professionals growing very fast, and can make this center being in a high quality dental treatment, which we could offer to all our patients coming here from around the world, and also a high quality dental education, which we could offer to all the participants from all over the world. So having this center in Sofia was our decision, based just in terms of good logistic, but it could be everywhere around the world, because it's focused and it should be an international. And so 3 years took us to brainstorm, to fine-tune. We found great architects from Israel, from many, we took opinions from our Italian colleagues, from our colleagues from Turkey. So we took a lot of our experience from our university in US, which we were working with, the NIU and the Columbia. And then we had a lot of meetings and thinking how exactly to make the purification system, the sterilization system, the working flow. It was, each detail took us like hours of thinking, working, exploring, in order to find the way, how to do it on really good quality, and of course to be functional and working on the right way. So if we start even talking about dental treatments, Eli and Mirella, they worked a lot to make a protocol for each dental treatment.
Yeah. We made a protocol, so each dentist here in the clinic should work on one protocol, which means that everybody in the clinics are working in the same way, with the same instruments, with the same materials, with the same spirit of everything. So they have the protocols of working, and also the assistants have the same protocol for how they should assist us and what we need. So this was the decision, and it was the background of creating this type of sterilization which we have now in this center, which is unique, which is like in the Columbia University maybe.
And also in Geneva they do it like that.
In Geneva, yes, we saw the same in Geneva University. And we just create here the same. Maybe it's better because it's smaller, but we try to be very precise on everything that we do. Even with Mirella and with all of partners, we stay hundreds of times to decide for each cabinet what type of things we need to have, what is the design of each part of the cabinet, which was very interesting, and it was very brainstorming because everybody have their ideas. So on the final, we found for us the perfect way of working.
Also, we tried to have the best quality from our suppliers. Let's say all the cabinets were done by two Italian companies, Saratoga and Dental Art, which helped us also a lot. So having the chance organizing the biggest meeting in Eastern Europe, we knew not also the best dentists, but we knew also the best companies. And this gave us the chance really to have a great support by brainstorming of all the people from these companies, how to create the perfect workflow, and also to use the perfect materials, instruments, and of course way of doing our treatments. So this is why we decided not to have like each regular dental clinic, in each office everything or some kind of instruments. Our dental offices inside are almost empty. So for each procedure we have a small card that we put for each treatment, the instruments, the materials, and it goes to the dentist. Once it goes to the dentist, he's working, then it's coming back to dirty sterilization, then it's going to wet sterilization, and each time we are going through a scanning process, so we are able to trace it. So we have a tracking system which is showing each instrument when it was used and when it has the dirty sterilization, the wet sterilization, and then when it was in the office and who was working with it. So we tried, and this is something that we got the idea from the Columbia University, that we track all the materials, all the instruments. So this is making our cross-infection control on a highest level today, which I think in this pandemic situation, all of us, we know how important is to save our patients, and this is why we invested a lot.
Yeah, the sterilization was brainstorming from a lot of companies. It was a brainstorming from the companies like for the washing machines, autoclaves, and everything inside. And they help us a lot to prepare the sterilization on the way that we want to work. The main point was that to have this sterilization and to work on this way, you should have, of course, the perfect prepared cassettes for each procedure, which means that we stay 100 emails together with the companies like Hufredi, who can help us to prepare the perfect and right instruments for each procedure. So we have it on the way that we need to work. This was the idea also with all the other instruments, all the materials and everything. So we after prepare these protocols of working, we prepare a book. The book is for the sterilization, and it shows how each assistant can prepare the cassette for each procedure. So they have the right places for each things that they should put. They should put a burst in one place, the matrix in the other, then they need to put the cassette with the instruments on the another. And to be easy for them and for us, we created idea together with some of the companies and some of the university that we saw this. We created idea to have the color cut system. The color cut system is something unique and something very interesting, because the color cut system help us to know what type of procedure you should prepare now. If you have, let's say, in our system, it's like this. If you have a surgery, it's red because it's bloody, it's something red. If you have aesthetic, it's blue because it's something nice. If you have, let's say, endo, it's yellow because our endodontists love yellow, so we made yellow everything. Each of all of these colors help us to know what will be there now with this patient. Even if you just look on the cabinet and you see that now it's red, okay, I'm going back because it's a surgery. Or if you see, let's blue, you can add or something like this. So for all of us, it's very easy to work on like this and to know what type of a procedure will be now. So the dirty instruments from the cabinets are going in dirty sterilization part, and then the instruments through the cassette are passed through the washing machines to clean part, where we have another lady who is staying only on the sterile part of the sterilization, which is autoclaved all the cassettes with the instruments. And then this is the cassettes with which we are preparing the cards for each procedure. And the most interesting is that these cassettes are tracked during the way of their sterilization. So the unique is that even we, like doctors, we have our personal cards with which we start our dental unit. And the dental unit knew that I'm a dentist. I love to work with the turbine with water or without water. I love to work with scalar on 40% water or without water. So the machines is suitable for your needs, and it's the same like with the materials and instruments that we track, because we know that myself, during the obturation, I always use only 3 instruments, because they are always tracked these 3 instruments, which is very interesting and very help us to know which doctors with which instruments are work, and to know if something happened with some instrument or material, where it is.
Actually, this is making the whole process much more efficient, because when you have the help of the software, knowing how much time the dentist needs to work with for a procedure, let's say just a filling, and which are his favorite instruments and what are his favorite materials. So all these data we use, and then we can make our process much more efficient. So the people in the sterilization, they know, let's say that Dr. Ruseva like these 3 instruments and like these materials, so they prepare it in the cart. So immediately after that, the cart is going to the office, she starts working without being much more fast. So because she doesn't need anything else and nothing more. So this is creating first a very good feeling in the patient, because the patients, they see that everything is coming especially for them, the birds in special box. So it's today we give the patient the trust that they feel safe in terms of infection, and this is really something that is very important. Maybe in the past we didn't put so much effort in the sterilization, at least in our country, but today, believe me, the people value that. And when we have investment in this field, this is coming back with a lot of patients who trust us that we are not going to infect them additionally. So this is something that we really think that makes our clinic very, very different, because having almost 100 square meter sterilization area makes sense, and having all this equipment also. Also about our dental equipment, we had the luck to have the huge support of the plant maker company, that they installed all the machines in the clinic and the educational center, and we had really also not only the support from them by bringing this equipment, but we had by creating the whole environment and the whole process. So also from then we had really very, very big support from that side, and of course we had the biggest support also from the Hugh Freddy company, because all the instruments we worked a lot to create those kits for each procedure, and they were so kind to prepare especially for us kids. I think again this was a very big
this was a very big working process, which they help us a lot about this, and also because we love to work with the instruments. Now we have them also in the educational center, and the participants are happy because they always ask us with what kind of instruments we work, what you use and whatever. So now they have the possibility to try them and to work with them, which for us is very important. The most important thing is to feel you are comfortable on the place where you work, with the instrument that you choose, with all the things that you have. So
actually we try to have the educational units that you see here like a real dental office. So each participants have the same unit like we have down in the clinic, have the same instruments like we have down, the same working flow. We have computers and PC in each place, so everybody can plan his treatment. He can plan the surgical guide or the smile design. Then we have a very nice lab down that they can print for us the surgical guides or the provisorios construction. So each dentist here feels like being in his own office, or at least in our office, following our workflow. And this is why I think this connection that we're talking about, having the opportunity to connect the clinic to the educational center, is putting for us very, very, very good value. And then having the research in the back, which is giving us really good argumentation why we are doing these treatments, and giving us the scientific basis on which to perform the treatments and to have all this big experience. This is making and giving us also the opportunity to be more effective and to be more scientific based in all our treatments and all our treatment processes. So basically what we want to have here is really all day long education by people working down with us, by people working here in these offices, and to have connected with the whole protocol of having really a high level, high-end dental treatment and high level dental education.
Yeah, well, one of the part of the clinics is operation surgery part, where we also use all our knowledge about how to prepare everything. So for us it's very important to have everything very good and precise, sterilized, with the right equipment for each procedure. So this is also the individual kits that we have. We create them together with Hugh Freddy and Tomnia company, with which we work for each procedure, which for us is very easy and also for the assistant are very easy to work. And it's nice to have these individual kits, like we have the individual cassettes for the instruments. So
yes. And then we have also something very nice, our really modern digital dental lab inside our facility. So it's another value that is giving us the opportunity to have 80% of our workflow fully digital. And again, we had the full support of Align Technology. It's also a very big growing company who supported us with almost 8 iTero scanners that we can use in our office and our education center. So this is giving us the ability to be close to the full digital workflow in the clinic. All our implants we only scan, most of our crowns we only scan, and we produce big part of it there. We can you work with the best technicians around the world, sending them just STL file and then printing their provisional work or their pre-treatment try-in in our lab. So all this process is facilitated by the equipment that we have started in the beginning. And if you can imagine just below, because I would go and make a picture in the heart of our clinic where is the compressor and the aspiration system, and you can see there about 2,000 meters of tubes all around, and we can see there also about some kilometers of wires for the IT networks, which is everywhere. And if you can imagine that this had to be planned in a rough construction, it was a huge journey.
Yes.
And
but now we are happy that it works completely great for us, and we are happy to have it and
yes,
to work. So we are welcome everybody to come
and to see us. And I would say one of my students who came and who was helping us, and I told him, I asked him, tell me please, what do you think about the clinic? And he told me, you know what, this clinic is not for dentists, it's for dreamers. So in order to be here, you need to dream. So thank you very much for your attention.